everyone, I'm Chastity Scasta and I'm here today to share with you my interview experience with somebody who I have known probably my whole entire life. She is best friends with my grandmother. They met in nursing school nearly 25 years ago, and I've never known her on a professional level. I didn't know what she did. I didn't know what exactly she did in administrative work. And so when this assignment came up, she was the first person that I thought of and was really excited to get to know really what she did. So, her name is Becky Morton. She is the interim case director at Northwest Hospital here in Amarillo, Texas, and she has been doing that position for just a couple months now. She was in case management for a while, and then she also was a nurse before that. So, one of the first things that I love to do when I'm talking with somebody is just to kind of really get to the bottom of like what they think that got them to where they were. What was their schooling? What was their relevant work experience? And what do they think that, played a bigger factor for them? And so, for her, her path to where she got was she got her associates from AC, and then was a nurse for quite a while, and then she went to case management for almost 11 years, being dually trained in insurance and discharging patients. And she said that she got her accredited case manager's certification, and you know to me what she kind of was explaining was it really helped getting that relevant work experience and getting to know the people who are in that department fully, and being a nurse while also doing the administrative work was a big help for her. So I really wanted to also get to know what she did on a day-to-day basis and what pressures that she felt at her job and how she dealt with them. There was a little bit of laughter here because, she taking on this management position was a lot for her. And, she kind of explained to me that it's just trying to find the balance between being a patient advocate while also keeping in mind the bottom line. And I think for me, if I don't decide to go into healthcare, that is a great thing to take in any field that I decide on. And so just really understanding, what your customers need, what your patients need, what your people that you're dealing with need, while also keeping in mind the business and finance side of things. So that kind of leads into another question that I asked about, situations that she deals with at work, when she became frustrated or impatient, and what does she do about it? And this was when she brought up the homeless population, and she talked about how there's a few of them who know how to take advantage of the system and know that if they complain of chest pain that they're going to get a night to stay at the hospital and probably another couple nights of observation. So she was just explaining the frustration of wanting the care for them and wanting to give them shelter while also making sure that there's enough rooms and beds for people who actually need it. And so obviously if somebody is actually having chest pain and actually dealing with medical condition, they want to help them, but they also want to make sure that no one is taking advantage of the system. So that's something that in her day-to-day life is a balancing act for sure. So another thing is what does she feel like they contribute the most to the department, and what was her role in that? And her answer was patient advocacy, trying to find safe discharge options for patients and preventing readmissions into the hospital, because if this is something that I learned in this experience was, if a patient goes home and actually has to be readmitted, they actually get a penalty for that. So that's a part of her job, and she feels like they really contribute to the hospital and the organization by preventing those things. So I think there was quite a few things that I learned from this experience, and one of those things is, that there's going to be a lot of situations that come up, and it's how you deal with them and what you do in those situations that really defines you as a manager and defines the community and the culture that you're trying to build at your company. Some quotes from her about similar things were, when we were talking about how you build relationship with people. And one of the biggest things that she says that she doesn't ask her employees to do anything that she want to do herself. And I think this plays into the fact that she was a nurse and she was in case management before becoming the director of case management. And I think her understanding all of the different roles that go into that has really helped her connect with her employees. And it's building those relationships on the personal level. And for me, that was something that really resonated with me, and it felt like, you know what, that's something that I want to make sure that if I become a manager, that there's no big power shift, that, I'm still building relationships. I understand what everyone does in my department. And another thing that she mentioned was when dealing with, a hard situation, what does she do in it? If she's dealing with something going on where she's having to directly ask somebody their side of a story, she said, listen to them first. Don't be accusing. Diffuse any situation that you can and ask them how they think that they can handle the situation in the future better. Because at the end of the day, you know, it's not about trying to, you know, get somebody in trouble. It's about trying to build a relationship with that person and making sure that they feel like they can come to you if there's an issue. And so, overall, I feel like I learned so much from this experience from her. And, I really loved getting to know her on that professional level and getting to know what case management was. Because that's something that, if I decided I wanted to go into, I can now, because I feel like I have a mentor in that department and in that world that can help me. And so yeah, I loved this experience. And my question to pose to you is, what are some things that you learned from your interviews that you will carry on if you became a management in that position? So thank you so much, and y'all have a great day. I appreciate you watching.